Today, we're talking about the recent ruling out of the U.S. Court of Appeals for the Fifth Circuit about mifepristone. I have seen so much misinformation and rage bait. We really need to talk about this ruling, what it really says, what it really means, and why it matters if you truly want to protect women. And that's the topic of today's episode. Welcome to the Mamapologist. This is a safe place for your doubts. Here, apologetics meets discipleship. So join me as we learn to think biblically about how to walk through this life as believers, struggling with tough questions, seeking hope, and finding answers together. Now, on May 1st, 2026, the United States Court of Appeals for the Fifth Circuit issued a stay regarding the abortion pill mifepristone, and the internet lost its mind. X has been a complete meltdown of pro-abortion groups and Democratic lawmakers raging that this is effectively a federal abortion ban, and abortion is under attack, and no judge should come between a woman and her doctor. But is any of that true? Well, let's get into it. First, we kind of need to rewind a little bit and go back to the Dobbs decision. So when Dobbs returned the issue of abortion to the states, Joe Biden directed the FDA in Executive Order 14,076 on July 8, 2022. He directed the FDA to expand access to medication abortion, which includes the pill mifepristone and the follow-up misoprostol. Now, Biden's goal was to expand a woman's ability to get a medication abortion without needing to see a physician in person. Whether you're pro-life or pro-abortion, this should matter to you because women should be protected from unsafe medical procedures or procedures that have a significant risk or likelihood for adverse effects. Now, if you followed this podcast for any length of time, you know I'm staunchly pro-life. But today I'm actually going to not be talking about this from a pro-life position for the most part. We're going to be talking about this just from the standpoint of protecting women and their safety. In order to discuss the concerns we have regarding mifepristone and this court case, we really need to understand what happens in a medication abortion. Now, mifepristone blocks progesterone. When the progesterone is blocked, it will cause the death of the baby. Progesterone is necessary for maintaining the uterine lining, which supports blood flow to the baby, which includes oxygen and nutrition. And it keeps the uterus from contracting. So progesterone is really important for the development of the baby. Once you take the mifepristone, the uterine lining will start to deteriorate. It will starve the baby of oxygen and nutrients, and that causes the eventual suffocation and starvation of the baby. Now, the second medication, the misoprostol, that actually will cause the uterus to begin to contract and to expel the fetus. Following Biden's executive order, the FDA altered its safety guidelines for the medication abortion regimen, allowing for online telehealth prescribing and mail order delivery. The state of Louisiana challenged this legally in court in 2025. They made several claims. One, that the FDA did not have enough data to assure the safety of changing their guidelines. And secondly, that this was allowing abortions to take place in Louisiana illegally. Third, they claimed that the state was being irreparably harmed by having to pay for the emergency care for women harmed by using mifepristone. The district court agreed with Louisiana. They believed that they would win on the merits of their case eventually, but they refused to grant the stay of the FDA rules at the time because the FDA said that they were investigating and would have results. Well, when the results were not forthcoming, Louisiana appealed the case, and the appellate court unanimously granted them the stay of the current FDA rules, effectively ending mail-order abortion pills immediately. Now, when the FDA approves medications or procedures, they can sometimes recognize that this is the best course of medication to use. However, there are some concerns, or this procedure needs to be done in this kind of setting. We call those guardrails risk evaluation and mitigation strategies. So it's abbreviated REMS. So I'm going to use the abbreviation REMS for the rest of the podcast. But so you know, that's risk evaluation and mitigation strategies. So the FDA looks at the REMS for every drug that it approves, whether it needs none or whether it needs significant guardrails to protect patients. The FDA sets up those REMS. Now, when the FDA approved mifepristone in the year 2000, the REMS allowed only doctors to prescribe it after 3 in-person visits. And they were directed to report serious adverse events. Those guidelines or protections for patients were gradually eroded over time without really the sufficient data to warrant reducing the safety protocols. In 2016, the rule had decreased to require 1 in-person visit with either a doctor, an NP, or PA, and eliminated the reporting of severe adverse effects to only fatalities. So that meant if you hemorrhaged or had to have a hysterectomy, ended up with sepsis, those kind of events weren't reported. Only fatalities were reported. So we're missing a lot of data there by reducing the reporting guidelines. And then in 2021, the FDA stopped enforcing the in-person visit rule and made the standard no visits and mail order in 2023 in the official REMS. That decision was not universally accepted. In fact, a group of physicians tried to take the case to the Supreme Court, arguing that this was not safe for patients. But the Supreme Court denied hearing the case, not on the merits of the case, but on the standing of the plaintiffs. Basically, you can't sue unless you've been harmed in some way. So the Supreme Court denied the case, arguing that the doctors themselves had not been harmed. The Supreme Court decided that basically the doctors didn't have the right to bring the case. They didn't hear the merits. They didn't consider the merits of the case. That was the only issue in front of them. The FDA announced in September of 2025 that they were reviewing the safety of the abortion pill protocol and the REMS, but they have not released their information yet. They're still gathering data. They're still collecting information, and we don't know when they anticipate releasing their findings. So the original ruling of the district court was to wait for the FDA results before finding for or against the state of Louisiana. When the results took too long and the adverse effects continued to affect the citizens of Louisiana and the state via the Medicare Medicaid payments, the appeals court decided to act and issue the stay. Basically, they granted this stay, which halts all mail order prescriptions of the abortion pill, because Louisiana was able to show that it would likely win its case on the merits once all the evidence is available. And it was continuing to face irreparable harm to its sovereignty and treasury. So every state has the right to create laws and enforce those laws that aren't already under federal guidelines. Since abortion was returned to the states, every state has the sovereignty to decide abortion for itself. Allowing mail order abortion pills violates Louisiana state law, which violates Louisiana's sovereignty. They estimate that over 1,000 abortions a month are illegally happening in Louisiana due to mail order abortion pills. Now, according to Louisiana law, no person may knowingly administer to, prescribe for, or procure for, or sell to any pregnant woman any medicine, drug, or other substance with the specific intent of causing or abetting the termination of the life of an unborn human being. So that outlaws the abortion pill coming into their state under any circumstances. So the court found that the 2023 REMS actively undermined Louisiana's sovereignty, which is equal to federal interference in state law. The court also found that the 2023 REMS caused financial harm to the state of Louisiana. Louisiana was able to demonstrate that they had paid over $92,000 for 2 patients, 2 women who needed emergency care following the use of mail-order mifepristone. So at the rate of about 1,000 abortions per month, the costs were going to rise and be exorbitant for Louisiana. Now, the FDA's conservative estimate for women who are going to need to seek emergency care following the use of mifepristone is 2.9 to 4.6% of women who were seen in person before taking the medication are going to need to be seen for emergency care. Now, this results in a conservative estimate of about 450 women per year needing emergency care at the very least. Now, if most of those women, which the state was able to prove, are on Medicare or Medicaid, this is going to be a significant financial cost to the state of Louisiana. The court additionally found that when the FDA reduced the REMS, they did so with a lack of evidence supporting that decision. Because the REMS had been reduced that required reporting of adverse effects, to argue that we can reduce the REMS because there are no adverse effects kind of begs the question. It's circular reasoning. Well, we stopped recording adverse effects except fatalities, and look, we don't have any adverse effects, so it must be safe. We can approve this reduction in safety guidelines. So the court was like, not so fast on that one. So the data is at best incomplete on the safety protocols. So by not collecting the data and then saying, hey, look, we don't have any data that says this is dangerous, isn't maybe the most effective way to make sure that a medication regimen is actually safe for patients. So that was part of the court's decision in issuing the stay on mailing of abortion pills until the FDA research is complete and the case can be fully argued, likely in front of the Supreme Court. Now that is for 2 reasons. One, the drug manufacturer has already requested an appeal that will go straight to the Supreme Court. And there were several other states that were pro-life that were making parallel lawsuits. So in order for them to all be solved at once and not have competing rulings, it's going to have to go in front of the Supreme Court. So now what does this ruling actually do? Okay, it doesn't ban abortion. Okay, it returns the previous REMS. So we're going back a few steps and just putting back in place the previous guardrails that the FDA had already established. It requires 1 in-person visit before prescribing the medication. It does not end medical abortions. Why does it matter if we have an in-person visit or not before getting an abortion pill prescription? Well, it's important for several reasons. First, and I think one of the most important, is that an in-person visit allows for an ultrasound which can verify the location of a pregnancy. If a woman is having an ectopic pregnancy, granted, they are pretty rare, but I know 2 women very close to me that had ectopic pregnancies. So it's not unheard of. It is something that happens fairly regularly and should be something that we look for. Because if you have an ectopic pregnancy, the symptoms of an ectopic pregnancy growing and getting ready to rupture can mimic the symptoms of the abortion pill working. And the abortion pill is completely ineffective for an ectopic pregnancy. It won't end the pregnancy and can lead a woman to delay seeking appropriate medical care because she thinks she's experiencing the normal working of the abortion pill, which could lead to a rupture, which could lead to her death, and certainly could lead to the loss of her future fertility. So making sure the pregnancy is located in the uterus is about safety. It's not about preventing her getting an abortion. Another reason for the in-person visit or ultrasound is to determine the number of embryos. In the case of a multiple pregnancy, is riskier, and there need to be some safety protocols in place. They might need to use a higher dose of the abortion medication, and they might need to be supervised for an additional bleeding risk. So that's important. And an ultrasound also confirms the gestational age of the pregnancy, which is really important. Because the embryo is expelled, usually at home, the gestational age plays a role in how safe that is for a woman to do without medical supervision. The risk to the mother increases with the gestational age, as does pain and discomfort. So having an in-person ultrasound is critical to make sure that women are not trying to abort a baby that's a lot more developed than they think it is. Some women are really great at knowing exactly when they got pregnant. They can tell you exactly what happened, where they were, what they were doing to the day. And some women can't. Some women don't realize they're pregnant until they're 2 or 3 months pregnant because they didn't miss a period till the last one. So it's important to have that ultrasound to make sure you're only 5 or 6 weeks or under 10 weeks. There was one study done by Mia Schmidt-Hansen, and it was published in a gynecological obstetrician journal in Scandinavia in October of 2020. And I thought it was an interesting study because it reviewed the data for medical abortions at home, and the rates of complete abortions without the need for surgical interventions were 92.3% in the 9 to 10 week group. So once you hit 9 to 10 weeks, you're looking at only about a 90% success rate for a medical abortion. That rate drops to 86% once you hit about 10 to 11 weeks. So 1 week difference between 9 to 10 or 10 to 11 can double the chance of the pregnancy not terminating. That's a big difference, especially when you're talking about women at home under no medical supervision experiencing this difficult end to their pregnancy. So the gestational age makes a real difference in how that pregnancy will end. We know it's obviously inherently dangerous for the baby. But if we're just talking about the safety of the woman, it makes a huge difference to know exactly how far along she is, because trying to abort a 12-week fetus at home could cost her her life, could cause a hemorrhage or a hysterectomy. Lastly, women who have Rh negative blood need additional care so they don't experience something called Rh sensitization, which could impact their future pregnancies. So they need to be seen in order to make sure that the doctors are aware of the complications that they could experience using the abortion pill. There are even some medical conditions that are serious enough that you shouldn't take the abortion pill. It's what's called contraindicated. This could be something like chronic adrenal failure or long-term corticosteroid use. If you have a bleeding disorder or if you use anticoagulants, you might even have an allergy to some of the ingredients. Some of these issues might not be covered in a telehealth session and might not be known by an online prescriber. So seeing a provider in person is just smart. It reduces several risks to the woman. And if we're about protecting women, this is a simple step to take to make sure women's lives and maybe their future fertility is protected. It's common sense, especially when we look at some of the rise of cases of men ordering mail order abortion pills and then secretly dosing their pregnant wives or girlfriends because they don't want to be a father. We want to avoid women being victimized as much as possible. The abortion pill being mailed also allows sex traffickers and pimps to use it to keep their girls in a state where they can be making them money, i.e., being used as prostitutes? Why do we want to support an industry that allows women to be injured and victimized? I think it's just common sense to return to an in-person visit before getting the medication if we want to protect women and their safety. If we're just about protecting women, then removing this bare minimum of care doesn't make sense. It only makes sense if there's a different motivation, whether financial or killing babies. Now, can I pause and interrupt you for a moment? If you're enjoying the podcast, please like, follow, subscribe, hop over to Apple Podcasts, leave me a review. It really helps get the truth in front of more people who need to be encouraged that there are good reasons for what we believe and why we believe it. Thank you. Now, the ruling is getting a lot of press, and a lot of people are using the fact that most people don't read past the headline to scare voters and think that this ruling has outlawed abortion. This ruling did not outlaw abortion. In fact, what this ruling does not do is make abortion pills illegal. If abortion is legal in your state, it is still legal to get a medication abortion. It does not equate to a federal abortion ban. It just returns the standard of care to what it was prior to COVID, and I think for good reason. It does stop the mail order of abortion pills by requiring women to be seen in person before prescribing the medication. And we've covered why I think that's wise. Now, abortion advocates argue that this equates to an abortion ban in many states, but that's the law of those states. The Dobbs decision made it so that each state gets to decide on the abortion issue for itself. California decides for California, Illinois decides for Illinois, Alabama decides for Alabama. And when we can mail things across state lines, it destroys state sovereignty. And it's actually a violation of the Constitution. So we know this case is going to end up in front of the Supreme Court eventually, probably pretty quickly. But for right now, the court has issued a stay blocking the mailing of abortion pills. And we need to ask ourselves, why are we upset about this if we're about protecting women? We know that this medication can cause serious adverse effects. And we know that we don't know how many or how often this happens because the data is incomplete. We're not required to track them. Now, this doesn't make any sense. If you're about protecting women, why are we not tracking what really happens to women that take these medications? Why is it not required? Any other medical procedure, you have to track adverse reactions. If you're sampling a new medication, even something as simple as cough drops, you have to test that it's safe. And that involves tracking adverse effects. So medical providers should be required to track these effects if we're about protecting women. If there's nothing wrong with abortion and there's nothing immoral about it, then why aren't we doing this? Is there something that they're hiding? Don't you want to know if a medication that you're going to take could harm you? Again, if protecting women's the goal, don't we want to make sure that these procedures are safe and as safe as humanly possible? Unless protecting women's not the goal. There's a financial incentive. The drug manufacturers have actually argued this in court, that they are being financially harmed by not being able to mail the drugs across the country. So which is more important? Making money by providing abortions or protecting women from unsafe medical procedures? As we discussed last week, our culture has devalued human life to such an extent that our ideas about right and wrong and how to treat each other have really kind of gone haywire. And that leads me to believe that the financial benefits are overriding the goal of truly protecting women, which is why I think that this ruling is so important. We need the FDA to finish collecting and reviewing unvarnished data about the safety of mifepristone, or the lack thereof. Obviously, it kills at least one human being between 92 and 95% of the time, which is abhorrent as someone who is, again, staunchly pro-life. But even if we ignore the death of the babies, we can see the abortion pill is not 100% safe. It's definitely not safer than Tylenol, as we often hear claimed. In fact, in the most comprehensive U.S. study to date about abortion pill safety, the Ethics and Public Policy Center analyzed insurance claims from 865,727 mifepristone abortions. 865,000 cases. So this is an extensive study. And what they found was completely different than what the FDA's warning reports. What they found is that they had a serious adverse event 10.93% of the time. More than 1 in every 10 women had a serious adverse event. 10.2% of women experienced serious medical complications within 30 days of taking the abortion pill. More than 1 in every 10 patients had to seek emergency or follow-up care due to serious complications. 6.3% required follow-up surgery. In over 6% of the cases, the abortion was incomplete, meaning that deceased fetal tissue remained inside the uterus, and the patient had to undergo a surgical abortion or a procedure such as dilation and curettage to remove the remaining tissue. The risk of surgery increases the farther along a woman is in her pregnancy. Over 2% of women experienced hemorrhaging, which is excessive bleeding, which can be dangerous or fatal unless you receive immediate medical treatment. Well, how immediate is your medical treatment going to be if you're at home in your bedroom or sitting over your toilet? There's a reason to have supervision for some of these medical procedures. 1.5% of women developed infections like sepsis that required antibiotics, hospitalization, or emergency care. Looking at these numbers, a conservative estimate is over 73,000 women per year. Now that's looking at, I think the average for abortion for 2025 was 1,125,000 abortions, something around that number. About 60 to 65% of those abortions are medication abortions. Okay, so I took the smaller number, 60%, and then I took the percent of 10.93 and divided it. So we have, out of all the abortions that happen in America in a given year, approximately 73,000 women are going to suffer a serious adverse effect from taking a medication abortion pill. Do those lives matter? I think they do. And I think that protecting women from making poor decisions with severe medical risks matters. Just looking at that one report, we can see the abortion pill is not the simple, safe do-over button that abortion advocates claim. And we need to do our due diligence to make sure that we're not so anxious to kill our babies that we're killing their mothers as well, or ruining their future fertility. Any medication that has that level of risk needs to be treated seriously and taken seriously, and needs to have protections and guardrails in place to make sure it is as safe as possible, if it's even necessary at all. Now, the ruling out of the Fifth Circuit doesn't ban medication abortion. It simply puts that issue back to the FDA REMS before COVID and makes sure that each state has the right to make their own laws regarding abortion. Now, as a pro-life advocate, I would love to see all medication abortions end. I would love to see all abortions end. But I think preventing mail order abortion pills is a solid step. I think it's a solid step just toward common sense. Like, medical practice should be about preserving the health and well-being of the patient. And while I think there are two patients in that room and we need to protect them both, mail order abortion pills doesn't protect either one. Women should be seen by a doctor for all the reasons we outlined before, to make sure the pregnancy is inside the uterus, it's not an ectopic pregnancy, make sure they're not multiples, and to make sure that the gestational age is appropriate for a medication abortion. No judge is coming between a woman and her doctor. The judges just said, we need to go back to the guardrails that were in place based on the information that we do have. We can't do long distance ultrasounds. And because of that, an in-person visit is crucial for the safety of women, regardless of where you stand on abortion. And that's why I think this ruling matters if you are truly pro-woman. Even if you're an abortion advocate, I think it's important to consider the safety and well-being of women higher than the ability to get an abortion easily. This is a common sense step, and I think it's one that all sides should agree to. Until next time, keep seeking truth. Hold fast to your faith. Never be afraid to ask the tough questions, because God has answers.